Okay, we'll call the meeting to order. Roll call, please.
John Wagheimer,
Here.
Stacy Hessel, Mark Helwig, Tom Duffy, Jeff Haney. You have a quorum. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Certification compliance?
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. The meeting agenda is set. Next, we have public comments, and I have Linda Zilmer.
Linda Zilmer, Edgewater property owner, resident of the village of Birchwood. I have a couple of different items for public comment this morning. Several months ago, I had made a public records request to get legal fees information from the county. And then maybe coincidentally or not, that month or the following month, there was a report made to this committee. And then there have not been ongoing reports of the legal fee costs to the county. And I think there was also a clarification where it was presented, when it was presented at this committee, how the committee would like to see those fees. And I know that the county continues to incur fees, but the public's unable to see how much and where that money is being invested. I think probably most of you in this room were at the Wisconsin Counties Association training earlier at the beginning of your term. There's a whole section on the budget process. I don't know if that was communicated to finance and to the other supervisors who did not attend, but I thought it was a very good presentation. It hit home on some things that I have made as a public records request, and now I'm going to repeat myself again, is that I think it would be very beneficial for department heads to make their presentations to the committees of jurisdiction, outline what their mandated services are, what additional services they provide, be honest, allow them to be honest about the staffing that they need and what it would really cost to develop a budget. And I think I will leave it at that because I'm probably approaching my 3 minutes. Thank you.
Approval of minutes. Any questions or seek approval?
I'll make a motion to approve the previous meeting minutes.
I'll second it.
We have a motion and a second. Any discussion? All those in favor? Opposed? Okay, minutes approved. Treasury report is included, and we will move to finance department.
All right, first we're gonna look at sales tax for July's settlements. We were a little bit over the last few years, another one where it's the highest month on record, and we're still on target for right around 3 million. We had budgeted 2.8 million, so we're still sitting in a good position. What I'm really interested in is seeing September settlements, because July was crazy around here downtown, so that's gonna be a fun one. Any questions on that? Moving on to the budget, we're at 57.5% of the way through the year. So revenues, expenditures should be right around there. On the revenue side, we're doing very well. General fund as a whole is at 59%. And then when I look at all the departments in the general fund, we are at, again, same 59%. But actually, if I back out that fund balance draw that we have in the budget, which we haven't had to do the last 3 years, we're at 61%. So that's good news. On the expense side, we're running very well. We're at 53%. If I net out that transfer to HHS, which we're hoping to not have to do, we're at 56%. So we're still running under budget a little bit on expenses. Each year we're getting a little closer budget to actuals. That's kind of my goal, is to not have quite the spend we've had in the past. So right now we're running very well. HHS, we're running a deficit, which is common for this time of year. The revenues lag with all the grant revenue that we rely on. And the expenses are at 53%, so we're running a little bit under there, and that's good. Some of those lag a little bit too because of our contracted services are always a month behind as well. And same with highway, we're in a good position. Our revenues are getting closer to budgeted. Expenses are still lagging quite a bit, but as of this report, we've really only had 1 month of highway construction, so that will catch up as we start paying the bills for all of that. Any questions on budget? Moving into 2025, I did not have time to get anything into the packet because it was early. Our meeting is very early this week or this month. We've got all the general fund stuff entered. And right now we're looking at including a transfer to highway of about $169,000. We're looking at about a budgeted $700,000 draw from fund balance. For 24, it was $750, so it's kind of right on par with where we're at. That is including every request from every department as well. There are some items we'll take a look at and maybe reduce the expense a little bit. I've got net new construction plugged in at 1.32%. We actually got conflicting reports from the state on the same day. One says 1.32, one says 2.0, and they both have all the figures on, like even the dollar amount of the construction. So we don't really know which one's accurate. Right now we've gone with the lower one. If it ends up being 2.0, that would be an extra $70,000 in revenue, which would be nice. We are in the process of meeting with all the departments. We've had a few meetings already. Met pretty extensively with both highway and HHS. And then we are meeting with the other departments as well. We have more scheduled. We met with sheriffs as well. Those are going well. So right now, with where we're at, I'm pretty happy. I think there'll be some adjustments between what's requested versus what we actually will have for an administrative budget, but probably not a lot. So that's good. Highway is all entered. They're, like I said, they're requesting about a $170,000 transfer beyond the allocation we give from property tax already. They are asking for a bit more on CIP, which we'll work on a little bit. HHS, I've got a preliminary budget done. Met with their leadership a couple times, and the one thing we might tweak is where I've got some of the people costed out to. That might change a little. Bottom line probably really won't change. So that's
Can I ask a question?
sure.
So on HHS, how much would it save us if we had a northern facility to house a lot of the outpatient?
We spend a lot on outpatient.
Yeah. It's like 2 million, right?
Yeah, it'd probably,
Maybe not quite that.
yeah,
but
the savings, it's still, if we had a
It's
northern
still-
facility, the bed cost is probably gonna be relatively the same. We
Mhm.
would save in transportation costs,
Okay,
which, I mean, that's probably, we're contracting that out right now because we're short deputies to do transports. So every time we do a transport to Oshkosh, it's $1,500 to $2,000. So we would definitely save on transportation costs. If we transport with a third party like Talon or Ready, yeah, that's how much it is for the staffing and the mileage.
and then we have not, from what I saw from the HHS records, we have 9 adults and 52 kids. So obviously it'd be better to have a youth facility than a adult facility?
No, well, the 52 kids, those are in a variety of, some are in foster care, some are
Oh,
in
okay.
residential group homes. So those can be varied. The youth ones, though, right now we have higher costs in our juvenile youth justice area, and that's like Lincoln Hills.
Okay,
So that's the youth facility. Would be good to have something, because right now when they close Lincoln Hills, the new facilities are replacing them with are probably going to be further away in the southern part of the state.
great. So the 2 hospitals that just closed in Eau Claire, if there's some way to reconfigure those into facilities for adults and youth, that would be supported, is what you're saying?
It would be, and that would
Okay.
be, that could be a mix of youth and adult. And we talked about this at HHS Tuesday night because Polk County has initiated a conversation because not so much for long-term beds, but short-term beds. That was our Sacred Heart was where we would take mental health holds on a short-term basis. So now The next alternative is Wausau or Oshkosh.
So Wausau and Oshkosh are the closest.
Right,
So the whole Northwest is
There's nothing.
ignored. Okay.
correct.
And they're full. So I sat in on a couple of those meetings, so I was just wondering how it would affect Sawyer campus. And thank
There'd be some savings,
There
not a
would be.
lot, but it would help definitely. Even a couple $100,000 would be,
Just you have something closer.
yeah. Well, it'd be nice for everybody if it was
Yeah.
closer. Like I mentioned, CIP is a little bit higher than we would like right now, so we will work on that to get that number down a little bit. And we also, there's a bridge that needs work and we're pulling, if you recall, we put some money into resource development fund that we were going to draw from instead of CIP. So that is including that even already of $400,000. So I'll keep working on the stuff. Right now, we'll have probably a moderate increase in the actual tax levy. The mill rate's going to be reduced by a significant amount, but our valuation increase was double digit again. So that's the reason for that. Any questions on 25? CIP for July, we had some IT stuff. They've been working on cameras and different things both at the courthouse and the sheriff's area. So that's kind of laid out there. Moving on to the investment report, another good month of $100,000 in interest. I did get an email, weekly I get email on CD rates and they dropped significantly this week. So we hit it at the right time. with
Good call,
Some
Mike.
investment. And we actually ended up getting a better rate than even was quoted because those are on the day and it ended up going up to 5.04 blended rate. So pretty happy about that. So we all made a good decision there. Any questions on that? Moving into ambulance billing. I'm starting to get a little bit more data now with the longer we're with the new company. So I'll look at the stuff that you're used to seeing and then our report from them will start to make a little more sense and we'll have more information to go on. So first, if you want to pull up the aging schedule. Right there. Yep. And then just go down a couple slides. So we've got two separate schedules because I've got one directly from EMSMC. And then what I'm doing is taking that data, going and pulling what we still have from LifeQuest and blending them together. And what I really want to draw your attention to is way over on the right on the second one, those percent current and percent greater than 120 days. Remember how those had kind of been getting out of control? The current kept going down, the longer ones kept getting higher. Well, the last 3 months, we've made some strides getting those back to where we want them to. So that's really good news. And I think a lot of that was a function of what the transition stuff just really wasn't probably getting the care it had before. So now we're getting that back on track. Moving on to the average calls per month, per 12-month cycle. The calls are basically where they've been last couple of years. We're down from 3 years ago, but remaining consistent. The billed per month, that's down a little bit. And that is one where I know John's been working with his staff on making sure we're billing everything we should be. And the new billing company has been helping him with that as well, making sure we're billing at the right rate. Like if it's a medical run, we want to make sure we're billing at that rate versus a lower level one. The average collected, that's actually coming up now from where we were a couple years ago. We're not quite to where we were last year, but we're making progress up there from even previous months. The percent collected, this is where we're starting to see some good progress. We're basically right where we were at our peak 3 years ago. And a little uptick last year, but definitely better than 2 years ago. So this is good news. And we're better than the prior 3-year average too, so. What we wanted to happen is happening now. Had a little leg over the transition, but now we're kind of back to where we want to be. Dollars billed and collected. We're still running a little behind last year, but on par with 3 years ago and better than 2 years ago. All right, then moving on, where the calls are going, again, our concentric circles are closer to the city, where the population is centered, then that's where the calls are going. No real change on distribution.
Is it Round Lake that's asking us if you got any updates on that, or where we at with that, please?
Not much really to update. We've gotten the call volume and we're working on the placing where the calls are coming from to see, let me back up. When the decision was made to build the station, the second station in Ojibwa, the county had done a EMS study to determine where the best locations. And that drew some conclusions based on the call volume at that time. So we're using current calls over the last year to see if that's consistent with what the projections were. Thus far, it looks like it is, like the distribution of calls. But we're just doing that at least to show, you know, the call volume that is or is not present in the Round Lake area and how it's being serviced, which is usually out of the Hayward garage. Beyond that, I mean, we've got, you know, cost estimates we know from the Ojibwa shop as to what it would cost if we were to build. And the operating costs as well, we have those to figure into a budget pro forma on if we had a station in Round Lake, what it would cost for us to operate it. From a staffing cost, we're not projecting a significant change because we would most likely shift an ambulance from here, the second ambulance in Hayward, out to Round Lake.
Thank you.
And then moving on to the income statement for ambulance service, right now we're showing a $86,000 loss, not out of the ordinary for this time of year, and hoping that as these billings get taken care of, we'll actually catch up there too. And then looking at write-offs, there's a big correction in May where I think they kind of caught up on stuff that they just realized we're not going to collect on. And then June was more typical. Charges to collections, again, there's actually been pretty consistent, big amounts going there through May, and then June really went down. And again, I think that's just a function of switching the vendor. And then some of the new reporting we've had the last few months, dispatch calls versus percent billed runs. And the last 2 months have been down. Just to refresh your memory, the blue line is the percentage by month. The orange line is the running average percentage, all those months together. And the green line is a snapshot of where we were December of 21 with that first billing company we had and carrying that percentage all the way across. I just kind of use that as a reference to see how we've done with each of the new companies. Not that it really depends on the company, because this is really has nothing to do with them. It's when we get there, if we decide it's a call or not, or we come home empty-handed. And that can be for various reasons. Just something to keep in mind though. It's just interesting, like it doesn't matter what the billing company is, but 2 billing companies ago, our blue line was very tight with the running average, and now we're kind of way up and down month by month. Then looking at the information a little more, this is by calendar year. So our percentage is on par with what it was 2 years ago. It's down from last year and 3 years ago. But the next slide does a 12-month cycle, which is what we look at most of this data through. And we're pretty much running on par with the last 2 12-month cycles, looking at it that way. Again, the number of calls are down, the number of runs are down, but the percentage that we actually are billing out stays about the same. And then this is the last month we're gonna look at this one because there's getting to be too many data points on there. But this is month by month, the percent billed versus for that month versus the running cumulative average of percent billed. So again, it kind of displays where what used to be really tight and now it's just a little more sporadic.
This is,
Every January is the same because the running average is only 1 month at that point.
looks like it.
Any questions on that? All I've got then.
Are you done?
I'm
Okay.
done.
Okay. Thank you, Mike.
I'm soft-spoken.
That's all right. I thought you'd say, ta-da. We're gonna go back to number 10 and I'm gonna turn it over to Andy here, but I asked Andy to give us an update on Act 10. Act 10, I have some concerns with that it is at risk. So if you look at a SWOT analysis, the T in SWOT is threat. I think there's a threat upon Act 10. What was it, 10, 11, 12 years ago it passed. I think you can credit it with putting Wisconsin from a deficit into a surplus. And of recent, a court judge in Dane County found portions of it unconstitutional. And I guess I think there's a scenario where they're going to go further than that. So I thought it would be important I don't know if everybody's aware of Act 10 and the benefits that it provided. If it were to go away, how that would affect the county. And so I thought it'd be important to at least I asked Andy and he agreed to give us an update on what Act 10 is, what's going on with it, with that threat, I'll call it. And maybe we just keep an eye on it from time to time. So with that introduction, I'll hand it to Andy. Thank you.
Sure, and just, maybe I'll start a recap of what Act 10 effectively ended collective bargaining rights for most public employees, public employee labor unions, exempted public safety unions such as police, firefighters, and sheriff's deputies. And I'm pointing that out because that'll impact what's happening with the court case in Dane County. But outside of, the ending collective bargaining rights, it required employees to make pension contributions to the state retirement system. It capped what could be bargained for strictly to wages and had to be within the CPI increases every year. Those were the big items, I think. But really it was because most local governments in the state were facing a deficit and it was a way to control costs of health insurance and retirement and wages, the entire package for public employers. So, that was back in 2011. It necessitated counties going to, instead of working with a union, you're dealing with employees individually. So counties that were contributing the employee portion of their state retirement had to stop doing that. It at the state level required employees to pay a minimum of 12.6% of their health insurance. Some were paying less than that. And then effectively what happened is most unions, when there was no really bargaining capability with public employers, most unions decertified. They didn't approve continuing to maintain the union at the local government. The court case, and rather than try to do my own analysis, just luckily earlier this week, Von Briesen, who is who we use for our labor attorney, put out a summary of Act 10 I had forwarded it to John and Ron. I forwarded it to the whole committee this morning if you want to read it, but it just gives a kind of a quick summary of what happened back in July. The Dane County judge, he issued a motion denying the motion to dismiss, so it has not been, no decisions has been made. It's just there was a motion to dismiss, and he denied that motion, and his basis was that what the court case really centers on is equal protection, and that when the Act 10 was passed, it applied to general unions, but they exempted public safety employees like municipal police and fire and state troopers. The court case points out that the Capitol Police, the UW Police, and conservation wardens were not exempted. And, they do the same work as municipal police and fire. And he's saying that nobody's given him a rational reason why one group was included and the other was not included. And then he makes some broad statements in his ruling that, because it appears that there might be unequal protection, he's bringing in general employees to this. Why should general employees be treated differently than public safety employees? So his decision actually is that he ordered the parties to file documents with the court as to whether how does it say here? Files with the court as to whether the court should issue judgment on the pleadings in light of this unequal protection, and which, he's talks about severing, that all the unions should be treated equally, but he's not bringing in the collective bargaining items that were part of Act 10, like the health insurance and the retirement, and there's some other items in there as well. So they're waiting for those to be filed with the court. Von Briesen, gives them a summary as to, local governments do not react because this is very preliminary. There will be appeals. There'll be no decisions been made. There's likely to be appeals. This is only applicable in the Dane County Circuit Court. This is not a statewide court. They point out also that we've been out of this environment for 13 years, and that there are employees who don't assume that employees will want to go back to having public employee unions, that people have become more accustomed to dealing with the employer directly. And I'd say even that it took a lot of years, I think, for local governments to get comfortable with that. But I think now we're at a point where we're more comfortable dealing with employees, and school districts, I think, are doing the same thing. I know, maybe not, I haven't seen this as much in the county, but I saw it in the public school sector that certain teachers that were part of the union now, I'll just use tech ed teachers as an example. They're highly marketable, and they kind of were able to become free agents and negotiate better wages and compensation that they would not have gotten part of the union because they are such high demand and such low supply. And then once this circuit court makes a decision, there will be appeals. So they're, just telling everybody to stand pat and see how this plays out. I don't, like the chair points out, it is a threat from a financial standpoint that if we were to go back into that environment of, giving, employees ability to negotiate for more than wages, we're already still under levy caps, tied to, our increases are tied to net new construction. And we'd have to make some pretty hard decisions on what to keep and what not to do. I mean, really, even right now, when we talk about budgets, it feels more or less like we're doing the mandated services and we're not doing other things maybe we'd like to do because we have to make sure we can afford to do the mandated things. So I don't know that there would be a good way to come up with additional monies that it might cost if provisions of Act 10 were repealed. I think the other thing that's maybe changed too in the last 13 years is just the environment we work in now for employees. I mean, yeah, we have to be more competitive in order to attract and retain employees, so that it's freed us. I mean, you kind of have to look at your health insurance. You're not tied to just doing the same thing with health insurance. You have to try to improve it. Same thing with, Wisconsin retirement system has always been a fully funded pension program. It's a pretty good benefit for the employees. But we find that, even younger employees could really, people used to come into this type of a workplace, they were looking at a long-term employment and having a pension. That's not as big a value now as it was. That was a big part of the union, being a part of a union back then. So I think the environment of just the workplace and employees and how you attract and retain them has changed.
Glad you mentioned that last part is that, a lot of, again, it's just maybe a nightmare scenario, but a lot of things, a lot of cuts would happen. I mean, if it went back to that and, I'm hoping that it's, not, but, I think there's other forces at play here beyond what's good for the citizens of Wisconsin. I think there's folks that would, be fine turning it back to look how Illinois looks. Illinois seems to be fine and they're going bankrupt. So I mean, there's forces at play that want it to go back. And I just think it's important we keep an eye on it. And I think you satisfied what I was looking for. I don't think we have to talk about this every month, but from time to time, just get updated and be prepared that if it goes a certain way, I don't even like to hear the word appeals because there's a scenario there where that's where they want it to go. To be appealed all the way up and then change things. So I think we just keep an eye on it from time to time and understand that if it goes the wrong direction, we'll have tough decisions to make.
Yeah, thanks for putting it on. It's something I haven't even thought about for a long time.
Just from a practical perspective, Sawyer County, when Act 10 went into place, was already, employees were paying 12% already. So we really wouldn't have a change there. We didn't have a change then. But it would be about $900,000 in WRS if that went back to us having to pay the whole amount. So that would be a huge budget hole for us. We're in better shape than a lot of places because of the health insurance, but just the WRS alone would be painful.
We don't have to talk about school, but next school. Questions? Thanks.
Yep.
Radio communication project update.
So I'm gonna try to keep this brief today because I've asked the chair to take time at next week's county board meeting to put the whole proposal out on the table for the full board. I know we've talked about it here in public safety, but I think we're at the point where we need to get the full board up to speed on the current state of our radio system, the deficiencies that we've identified, the proposal to build a new or improved public safety network, and then the options of how to do that with either building towers and leasing them, or building them and operating them ourselves, leasing them, or partnering with Bug Tussle, who would build a fiber network with 7 tower sites that we would have the ability to use to put our equipment on. Then they would also sell broadband and cell phone leases for cell phone service on their towers. As I've talked, Bug Tussle, we would extend the county borrowing capacity to them for that. And we're still going through the due diligence on Bug Tussle because that is the item or the opportunity that has a timeline that we're looking at needing to commit within the next month and a half. So what was on the agenda was some of the agreements that have come through from Bug Tussle. There's actually more. There's like 15 different documents that we've had to review and council's reviewing. We have bond counsel also working on Bug Tussle on behalf of, or for us, but covered by Bug Tussle to go through this. But rather than get into all those details, we're just going to do it at the board meeting. So all the board members here, we're not asking for a decision next week, kind of getting it all out there so everybody knows and understands the radio network, what's being proposed, our options, and then you're prepared hopefully to make a decision within the month after that. And really it's a question if we go with Bug Tussle or not. If we do not go with Bug Tussle, then we focus on building our own infrastructure, and that'll be more part of the budget to be considered. We've got projections on if we borrow to build $2.5 to $3 million of infrastructure, what the impact would be on the debt service levy. But this is all presuming that the board agrees that they want to go ahead with upgrading the public safety network.
money to do that.
Yes, exactly. So already doing that.
What's our timeline? I mean, when do we have to?
Bug tussle right now is the thing that's driving a timeline, is that they have asked the counties that are considering it. And some counties are just doing it because they want to bring better broadband and cell service to their counties. A few of them, like us, are looking at it as part of a public safety network. But September 10th is currently the day when they want to have all the counties either in or out. There is some discussions ongoing, or I believe ongoing, about maybe a little bit of extra time. I've not heard an update on that. We had a meeting last week amongst all the counties that are part of this. They've done this for a couple of years, Bug Tussle has, with, a group of counties. This is the next group of counties that are, and some of them are counties that are already working with them. So you can see up there, just for perspective, Forest, Iowa, Jefferson, Lafayette, Marathon, Price, Sawyer, Taylor, and Washera are the ones that are looking at a partnership with them in this project. So all those counties have to, September 10th is currently the day where all those counties have to be in or out.
That is before our next.
It is. And so if that date does not get moved, I'll talk to the chair about having to have a special board meeting for that. Those counties also, that when we had a call with them and we had the financial consultants and the legal counsels on the line that are working as intermediaries, gathering up due diligence, reviewing the legal documents, and then also, effectively, if all of these counties are extending borrowing capacity to Bug Tussle, and we call it Bug Tussle, that's basically their, I'd say, their brand name. There's actually a company I hear about called Hilbert Communications, which is the parent company. We're looking at how to do, like, I'll call it a stress test. Essentially, we're loaning them, even though it's not a loan to start with. We're giving them borrow capacity, but we need to look at their credit worthiness. Because if they default on the loan payments, it becomes the liabilities of each of those counties that are involved. So there's still a fair amount of financial analysis that's ongoing to be able to share with you whether we think it's a good credit risk or not. And I would, one of the things we've discussed with these counties is that, like I said, there's a group of counties that have already done this, like Oconto, Jackson, Oneida, some of those, Marathon, Jefferson, and Taylor have already been part of prior rounds. And so on one hand, you look and think, well, that's pretty good that counties that have already done business with them are going to do more business with them. And there's a group of counties that have done business with them before. Well, a lot of those projects from before are still in progress. They're still getting built and getting up and running. So there's not necessarily a full track record or full history of financials. And also it's like, there's a lot of counties working with them already. So it's probably a good thing, like, that those, we're jumping in with a group, but at the same time, okay, now we're the next group of counties. Are they over leveraged or so we're trying to get as much information to prepare you and share with you as we can.
I think I remember the answer, but to that point, to me, one of the questions is, do we want to be in that business or not?
Right.
And outsourcing, would be going to them. Even if they did default, we're back in the business. So,
right. If they default,
we're back to where, I guess there may be some financial loss there, but we're back in the business, which I don't know if we want to be in that business, but you're back to you started from, I guess.
Mm-hmm.
Any other questions on that?
So so next week we have GenCom making a presentation to the board. GenCom is our radio consultant that's assessed the current rate and assesses and services our current radio system and has proposed the new radio system to get us the coverage we want. Bug Tussle will be presenting and legal counsel will be explaining the legalities of everything. So it will be a bit of lengthier presentation.
Good question.
Yes.
Say we go with them would they be able to give us a starting time? I assume they would, but how long would it take to build that? Structures that we presume to have?
Yeah, regardless of if we do it ourselves or go with them, we're looking at probably more than a year, closer to 2 years. Just because of the time for tower permitting and construction.
So how are we being effective on our emergency services within that time then? I mean, right now, I've heard a lot of frustration from the outer parts of Sawyer County. So how are we addressing that in that time?
There's some areas of the county that are very poorly served. And they've done as much as they can. GenCom has done as much as they can with our current radio system to get as much out of it as we can. And they've had to go out and remount some equipment, secure equipment. There were some that, dishes or antennas were, they're not securely attached. So there was, the wires were hanging. So they've done as much as they can to service what we have. That's all we've done. So there are just areas of the county right now where it's not on the portable radio coverage is very poor.
No solution faster, really. I mean, right?
There really isn't from what we've discussed.
Yeah, there would be, but the cost benefit would be the
Unreasonable.
biggest thing, yeah.
Did somebody take our picture when we were talking? Did you hear that click?
Nothing on the radio network.
Yeah.
Oh, so that's okay. So in future. I'm just reading the script, the lines that are giving me. Yeah, the teleprompter is telling me to say that.
Do you want to explain that or?
Yeah, this is the canned report we get from PFS. Now that we're 3 months in, starting to see. It's very nice.
The pie charts.
We are getting one.
Hit your mic.
That's the last time I've seen it.
Eventually, we'll see if this is sufficient for what you guys need. I think once we get 6 months in, we're gonna have some pretty good data here. And the old Life Quest stuff will pretty much be going away. So we'll address it at that time, but this kind of shows, what the charges are, anything that's not allowed, and then the net charges. What's been paid on that, the balance due. So it's similar to an aging schedule, but it's got more information. And then the line graph below it will start making more sense. That's kind of like those ones where I have the cumulative average. Once we get more months under here, that green line will make a little more sense because it'll be more caught up to the month by month. And you'll start to see how we're running against previous months then. And then the other nice thing we get with this report, if you want to go down to the next page, it breaks everything down by payer. So we've got Medicare, Medicare Advantage, insurance. The next page has Medicaid, Medicaid MCO, patient pay, which we have very high self-pay percentage. So it's going to break everything down. You'll be able to see the timing of the payments, what type of payers coming in sooner than others. So once we get more months under our belt, it's going to be very nice. Facility, the other government payers, there's 3 pages alone of just a payer breakdown. And then the next one gives a summation of the current, this is an aging schedule, the current, the 31 to 60 days out, 61 to 90 days out. And then it gives the percentage of each category, which are only 3 now. So it's pretty heavy on current. But then the next pie chart next to that shows the accounts receivable by payer. So there again, it's breaking down by who is actually paying the bill. And we've talked about this before, but you can see Medicare is 32%, Medicare Advantage is 16%, Medicaid's 4%, Medicaid MCO is 5%. So we're very driven by, you know, basically government payments, which are not dollar for dollar. So that shows why we'll probably never hit that goal of 50% collections just because so much are going to be discounted. And then the final page just kind of shows, again, accumulation of accounts receivable, what was charged, what's been paid, and what's outstanding. So I really like these reports. They're giving us a lot of good detail. Yeah,
More information.
I think so. I don't have that kind of breakdown right now with LifeQuest.
That's great. Thanks, Mike.
Yep.
Future agenda items. Any suggestions? Any correspondence from other meetings?
Oh, yeah, that'll be gone, but that's fine.
All right. Thank you, everybody. We're adjourned.